We have a 48-year-old male with heavy alcohol use who was brought to the hospital. He complains of nausea and vomiting, as well as severe epigastric pain radiating to his back. Vital signs on admission. His heart rate is 128 beats per minute. Blood pressure is 98/60. Respiratory rate is 22, and temperature is 100.8. He has decreased bowel sounds, bluish discoloration of the periumbilical area, and he is guarding his abdomen. Hello everyone, it's Nurse Mo from ROFEM NCLEX Academy. Let's complete the breakdown of this case study using the 6 steps of the NGN Clinical Judgment. The NGN step 1 is recognize cues, and that is finding what matters most. Look at the clinical situation. Find relevant data versus irrelevant information. Cues are client information you can use to make clinical judgment. For this patient, here are the cues that are most important. Severe epigastric pain radiating to the back, nausea and vomiting, abdominal guarding, and decreased bowel sounds. Take a look at his heart rate. It is 128 beats per minute, and so tachycardia. Low-grade fever is there too, and that is another important cue. A bluish discoloration of the periumbilical area, that's very, very important. Other cues are elevated amylase and lipase, leukocytosis, take a look at his WBC, and mild hypocalcemia. In the next video, we will move forward to the NGN step 2, analyze cues for the same patient. Let's continue with the NGN case study we're working on. The 48-year-old male with heavy alcohol use. Remember, in step 1, we recognize cues. So in step 2, we will find the connection between the information we identified and the client's condition. This is the question we need to answer to analyze cues. What is the primary change that's going on with this patient? And here are your choices. Answer choice A, decreased gastric acid production. B, autodigestion of pancreatic tissue. C, obstruction of bile flow. D, reduced insulin secretion. What do you think is the correct answer? The correct answer is B, and here are the reasons why. I want you to take note of the fact that the patient has heavy alcohol use. Alcohol can cause direct injury to pancreatic cells. In acute pancreatic inflammation, there is premature activation of pancreatic enzymes. Eventually, tissue destruction is the result. The normal process is for the pancreas to make digestive enzymes, which will be inactive until needed. When digestive enzymes from the pancreas become prematurely activated, they start breaking down pancreatic tissue. This is autodigestion. Epigastric pain radiating to the back, that indicates pancreatic inflammation and possible irritation of the peritoneal membrane. Elevated serum amylase and lipase, this is a confirmation of pancreatic cell injury, as well as autodigestion of pancreatic tissue. The other thing we have listed that is very, very important, that is the bluish discoloration of the periumbilical area. This is calling sign. It is a sign of pancreatic inflammation. This is the analysis of the information we identified in the NGN step 1 of this case study. In the next video, we will move forward to NGN step 3, prioritize hypotheses. Let's talk about the step 3 of the NGN case study we've been working on. This is where we will find the priority health problem in the case study. When you prioritize hypotheses, you will look at the data you have. Then you determine what's possibly going on in the client's situation. This is where you will identify the priority health problem. How serious is it and why is it serious? Take a look at this question. Which complication is the priority concern at this time? Answer choice A, malnutrition. B, hypoglycemia. C, hypovolemic shock. D, chronic pancreatitis. Which one do you think is correct? The correct answer is C, hypovolemic shock. Let's break it down. In this client's situation, take a look at the blood pressure and the heart rate. His blood pressure is low and the heart rate is high, tachycardia. The next thing you'll do after that is to look at other assessment findings. He has nausea and vomiting, plus the possibility of intra-abdominal hemorrhage. This patient has third spacing of fluids. That's why he has hypotension and tachycardia. He is at risk for hypovolemic shock, which is immediately life-threatening. We don't have enough information to support malnutrition and hypoglycemia. And the scenario did not indicate that he has this problem before, so it is not chronic pancreatitis. In the next video, we will move forward to NGN Step 4, Generate Solutions. We are in the NGN Step 4 of the case study. It is time to generate solution. The priority problem we identified in Step 3 is hypovolemic shock. And in Step 2, we discovered that he has autodigestion of pancreatic tissue. In order to generate solutions in Step 4, you need to know the expected client outcomes. Then you will plan specific actions needed to achieve the expected outcomes. This is the question we need to answer to generate solutions. Which interventions should the nurse anticipate for this client? Select all that apply. Answer choice A, aggressive IV fluid resuscitation. B, keep client NPO. C, administer IV opioids for pain. D, administer pancreatic enzymes. E, insert NG tube if client is vomiting. Which of them are your choices? The correct answers are A, B, C, and E. And here's the rationale. Our patient is at risk for hypovolemic shock. So here are the solutions. Aggressive IV fluid administration is needed to prevent shock, and that will also help to maintain perfusion. Keeping him NPO will allow the pancreas to rest. There's quite a bit of inflammation going on, so opioids are appropriate for severe pain. NG tube will help to reduce gastric stimulation if the patient is vomiting. Answer choice D is not correct because pancreatic enzymes are used in chronic pancreatitis, not for acute pancreatitis. This is the step-by-step guide on how to generate solutions in an NGN case study. We are in the NGN Step 5 of this case study, and it is time to take action. We will take action by answering this question. Which of the following nursing interventions are appropriate? Select all that apply. Answer choice A, administer IV fluids. B, assess pain level. C, maintain NPO status. D, monitor vital signs. E, administer prescribed analgesics. Which of them are your choices? The correct answers are all of them. And here's the rationale. IV fluid administration will address the risk of shock. Assessing pain level will help the nurse to medicate appropriately and ensure the patient is comfortable. It is important to maintain NPO status, and that will help to reduce pancreatic stimulation. Monitoring vital signs will help to assess progress and check if the patient becomes unstable. Pain management is very, very important to promote quality of life and prevent irreversible damage. This is the last step in the NGN Clinical Judgment in our case study. We are in the NGN Step 6. This is where we will evaluate outcomes. We will evaluate outcomes on this case study by answering this question. Which finding indicates that the treatment plan is effective? Answer choice A, lipase remains elevated. B, decreased abdominal pain. C, calcium level remains low. D, glucose increases. Which one of them will you select? The correct answer is B, decreased abdominal pain. Let's break it down. Whenever you evaluate outcomes on your patients in a case study like this one, look at where you started and follow the progress of the scenario. Look for clinical improvement, which will be reflected by relief of symptoms. Answer choice B shows a decrease in abdominal pain. That's an improvement. The other answer choices are not correct. Thanks for watching, and I hope you learned something from this video. Like, comment, and subscribe to this channel to stay updated. If you have any questions, you can place them in the comment section. See you next time.